Hello friends, today we will be discussing about the pediatrics part, the much awaited one. So firstly, let us have a proper orientation on how are we going to approach this subject. The paper is for 100 marks, not like the other major subject where we are going to write it for 200 marks. Yeah, it's for proper 100 marks. So basically, based on what they have given, I have just tried to simplify it and place things in order so that we can study accordingly. And I have divided into 12 major chapters, this being the core pediatrics part and this being the systemic part. Okay, these are being the systemic part and one miscellaneous which I have not included. So based on this, we have predicted the paper. We have gone with these are the single chapters which are present. Okay, so for you to have an overall overview, so I have just mentioned what are the specific chapters which you need to follow. Again, focusing on core pediatrics, you will almost get about, sorry, this is not core. Okay, only these three are core. So 15 30 40 marks. Okay, roughly half of the paper marks you can get it only with core pediatrics. So the major aim for us would be to study the core pediatrics in proper, that means not leaving any RS questions in that part, and focusing and clubbing the all extra part of the systemic part of pediatrics with the medicine, and just making sure that what are the extra things which are there. For example, in CNS part of medicine, you might not study about cerebral palsy, but study and also neonatal meningitis or neonatal seizures or febrile seizures. That thing we are going to add in this video, and also the things which which are not important. For example, GBS is not important. Okay, multiple sclerosis might not be seen. Those things we are omitting it out, and we are studying things which are only important as a part of pediatrics. Okay, so that's the overall idea. Again, we will start with systemic because this is something which you need to study in adults. So let us see how to approach systemic pediatrics, keeping in mind about the medicine things which we had studied in the part 1 and part 2 of medicine, which we have uploaded earlier. And based on that, let us see what are the extra things which we need to add. And again, there are few cases where it's just, again, asthma and all those things are again the same thing which is asked there and also has been asked here. Again, here the major things which is changed is the dose. Okay, and again, they don't expect you to know dose for everything. That's the major advantages part where as a UG you are in, correct. So based on that, let us see how to minimize the load of studying in the under pediatrics. So again, these things, let us be very clear. Again, these are the major things which you need to classify and study. So let me clear it out in the first itself. So basically, first thing which you need to study is first thing on the day before exam, start studying these things. For example, the core pediatrics part which is present, for example, growth and development and nutrition and micronutrients. And under single, the growth and development and all this comes under chapter 2, chapter 3, chapter 4, chapter 5 and chapter 7 and 8. Okay, neonatology itself is under chapter 9, and immunity and immunization is under chapter 10, and infection and infestation is under chapter 11. Okay, then again, this is the next things which we go is about these things. Again, the management of hyperkalemia and sodium hyponatremia is something which is that again under a part of medicine only are studied here. There is no change in management except the dose, but again, you need not remember dosage in pediatrics as a UG under UG level except for some emergency situation. That's the advantage. And again, here GA, what are the extra things which we are learning except from medicine is that one is acute diarrhea management. Okay, then again, portal hypertension cause with respect to pediatrics. Again, cirrhosis cause with respect to pediatrics. Here another separate column of congenital things is something which you have to enforce or enact. Okay, then hemat and malignancies I will discuss in detail. Okay, then also RS and if you are starting with systemic part, the first two systems which you need to deal with RS and CVS. Okay, that's how we are going to start now. Then the second system which you need to take is hemat and malignancy. The number of questions is less, but the marks weightage is more. So next thing which you need to deal is with that. Then next, coming to your CNS and neuromuscular disorders. Next, whenever you're free, finish GI because it has an easy narration. Then you can go with kidney and urinary tract. Then you can do this and this. Okay, so based on that, we are placed and also remaining miscellaneous things you can cover. So make sure you study. You might not refer the same notes which are given. Again, this notes was done in a hurry because many were requesting for the same, but I wanted to enforce the ideas or what do you say, or I want you to study in this way so that it doesn't feel burden for than studying from 1 2 3 4 of single, which doesn't make sense for me, because from one chapter they might not ask many questions, but this is the core which you need to understand before stepping in studying pediatrics. Okay, then again coming to the paper prediction part, I think I have already uploaded in my community, but just for sake of understanding what I meant, I am explaining the same thing here. I know here I am wasting much lot of time in explaining the the first part of it, because remaining all, even if you can see, you can understand, but I've got some messages saying can you decode further, for example in a few cases where you out what does it mean, something like that. So let me explain this in more detailed form. So 10 marker, what is the basic idea is that one question need to be from general pediatrics, one question need to be from systemic pediatrics. So from under systemic pediatrics, what are the according to weightage, what are the areas where you can get 10 marker? One is under RS, one is under CVS, and also where else you can see 10 marker? Hematite malignancies. But what is the problem is that hematite malignancies, they have never asked. Okay, but CNS and neuromuscular thing is something which is common. Again, I've written RS asthma as first, but they have never asked. This is something which we can expect. Okay, general pediatrics, let me be very clear. There is nothing more which they can ask except from growth and development or something related to nutrition. These are the only two topics which you need to study in and out. Okay, that even can come as a 5 marker also. But again, when coming to systemic pediatrics, first always study about CNS part of it, because CNS itself is a 10 marker question. Correct. Next, there are very few questions where they can ask about RS. Okay, for example, if asthma is not asked, they might ask you about ARI. But then finishing that part, you can also talk about CVS, for example, chronic heart failure, acyanotic and cyanotic heart disease. You can concentrate on that part also. So make sure you study that as well. And also hematite malignancy, still now they have not asked many things, so I am not including that as a part of it. But the major thing is that RS and CVS is for 15 marks. So what I feel is that since it's a topic which is having 15 marks, so one question might be from something related to 10 mark might be from either RS or CBS. Most probably is what these two I feel. Otherwise, CNS also can be asked. Though they might not follow this strictly, but this is what I feel and this is what they are following. Again, asthma you can study later. So this is what I wanted to give you a brief overall idea. Okay, next coming to CNS part, depends on what was asked as the 10 marker. You might expect a seizure question, or you might also expect a febrile seizures question. You can expect a case of meningitis also. You can expect a case of CP also. You can expect a case of hydrocephalus also. So what is the core idea? As I'm saying you from the starting of many videos, it's about predicting 1 to 10 questions. Okay, and in that 9 question can be also a part of 10 marker. In that 10 question can be a part of 10 marker. But the major idea core is what? So that with those 10 markers, you have those 10 questions or 10 topics, you need to be well versed, so that even if they have if it's a 5 mark question and if they're asking for 10 marker 10 marker, you should be in a state to write. Okay, so again, whatever is predicted there is the same thing which is there. One thing is that I have missed about febrile seizure. Please make sure you add that. And also coming to general pediatrics, it's about 14 marks. If it's 10 marks, let us think it has gone here. Then what about the 30 marks? Again, here 1 or 2 questions related to general pediatrics has to come. So where is that in the sense is that one related to neonatology is something which is sure. Again, in neonatology, what are the core broad topics which you need to study is about the neonatal injuries. Okay, I'll be discussing it further. Again, what is the next important thing which you need to study is about the major 2 conditions which is there, that is jaundice and RDS. Then something related to comet related thing. Again, this has a separate thing. So I am not clubbing that under this part, but one related to neonatology and one related to immunization thing has to come. Okay, these are some questions which has come. Okay, then coming to CVS itself. Okay, CVS itself, these are the same conditions which they have asked. Again, when I am saying PDA or VSD, you also has to be prepared for something related to ASD. If a bouncer has to be asked, then something related to that means cyanotic bar acyanotic heart disease is something which we are expecting as a 5 marker. That's the only thing. Okay, NADA's criteria is again, if they want to ask for 5 marker, again there are nothing much to be written, so they might ask for a 3 marker. Then one question related to your nephrology, again nephrotic, nephritic, uterine. These are the only 3 topics which is present in nephro. Correct. So you need to study only about that. And again, one community related question is something which is important. Again, they might ask about IMNCI or IMR. Okay, there are questions which we'll discuss later. So those are the things which they can ask. Then again, coming to your neonatology, as I have told, and one question related to HEMAT, they have to ask. Again, it need not be only TAL or error. They can also ask about Wilms. They can ask about ITP. They can also ask you about sickle cell anemia. They can also ask you about von Willebrand disease. Okay, some things which are common in children is something they can ask. And again, if no 10 markers, again they might ask something related to CNS, because the core idea is what? The core idea is make sure your general pediatrics, including your immunization, neonatology and the growth part, with your systemic pediatrics, including RSCVS, CNS is strong. Then nobody can stop you from passing the paper. Okay. Coming to 3 marker, as I told, the nature of 3 marker itself is unpredictable, and it can be predicted only based on your 10 marker and 5 marker. So one thing which is sure is something related to electrolyte related question is something which is sure. For example, they might ask you about hyperkalemia management, hypokalemia management. Also, they might ask you about, since even major acidosis part is also included, they might ask you about metabolic acidosis common. Again, divide into AGMA, NAGMA, again start writing the cause. Again, something related to infection, because there one thing related to immunization they are asked. Now 3 marker, they might ask something related to infection, or they might ask something related to infection as a 5 marker, for example enteric fever or dengue or malaria. And here they might ask you about dosage or side effects or contraindication of DPT or BCG vaccine. I hope you are getting the point, or I hope you are understanding that approach what I meant to say. Okay, so something related to that I have explained. Again, one comment related thing they have to ask, for example, something related to micronutrients is what they are repeatedly asking. For example, something related to vitamin A, vitamin C or rickets, or something related to KMs also they can ask. Okay, one related to toxicology or poisoning. Again, here what is the major thing is, if they are not asking one thing related to toxicology here, something related to that they can ask for 5 marker. For example, snake bite management or scorpion sting. These are the 2 consistent questions which they are asking under toxicology. Okay, so make sure you study that also properly. And something related to endocrine, again, there are only 2-3 questions which you need to understand. For example, congenital hypothyroidism, how do you differentiate between proportionate and disproportionate short states? So something related to that, there is something which they are asking consistently. Okay, again, CVS as a part, since it's a 15 mark weightage topic, again they might ask you something about criteria. For example, NADA's criteria, or something related to all these floating spells, how do you manage it, all those things. And one question related to your behavioral thing, for example ADHD or pica, some nocturnal analysis, something related to that also can be asked. And one obviously pharmac related thing and genetic related thing, again this can be asked also for 5 marker also. Again, what is the major important thing which you need to understand from 3 marker itself? Toxicology and genetics. Study little more, because this has a possibility to come for 5 marker also. For example, Down syndrome, or name 3 X-linked recessive disease, or X-linked autosomal dominant disease, or autosomal recessive disease. Only 3. Okay, nothing much, nothing more. Okay, so make sure you study accordingly and place the blueprint. And the major aim of the video is to not to make you study my notes. I know it's not for that, but make sure have this idea and sit and study your own notes or your own book which you are convenient with. These are the things which I follow, but at least till now what is the important thing is you should not miss the major things which are important, and you just leave it out. Okay, so that's what I wanted to convey. Now we'll jump to how to go with all the things. Okay, now what I am doing is that first let me discuss all the systemic part of it, so that I will just explain what are the overlaps which are present in medicine, and we'll club it together. Then come to core pediatrics. I will be not explaining much of it because it has an easy narration, and you can people have many preferences with when it comes to pediatrics, so they can refer their own book or own material which they are comfortable with. Okay, now coming to RS part of it, RS and CVS, that is I'm considering it as part 1, and it falls under 15 and 16 chapters of CING. So again we will discuss only about the important things which are actually important. Okay, then first question which we'll discuss about pneumonia bar ARI. Again, I am not discussing much about ARI because it was already you would have already studied under comment. Okay, here what is the important thing is, but one thing they might ask us about a classification. You can write about it, but the major thing which is different from medicine is what it's presenting here. So make sure you study only that. Okay, etiology changes. For example, here 0 to 3 months, the vaginal flora is something which is common. So that is gram negative, correct? I hope you know the concept of gram positive and gram negative. Gram positive infections are most common in skin and subcutaneous tissue, and gram negative is something which is present in gut as well as the genital urinary tract. Okay, so these are the things which are common. And again, make sure you place this. And again, the pathogenesis, same thing: red hepatization, gray hepatization, resolution. Again, you need to club there. Okay, then important thing which I wanted to emphasize on clinical features in pediatrics itself. Whenever it's a neonatology question or any question, any diseases which are common in less than 1 year, make sure you write this general part well. Okay, for example, a fever, lethargy, poor feeding, and there are many things, right? In on the general, poor crying, all those things. So you are showing the examiner that you are concentrating on general things here than the specific things, because baby cannot speak, correct? So that's the major aim. Again, here what the major thing is, here it's a clinical science which you need to concentrate when it comes to neonatology. Clinical features in the neonate is always general. It's your expertise, or it's your talent to pick up clinical science and then come to your clinical features. Okay, that's how you need to understand, and that's how you need to present. Okay, these are the signs. And again, all the nasal flaring, again in that I have explained about inspection, palpation, percussion, and auscultation. Please refer medicine part of respiratory medicine part. I think it's in paper 2, and present it accordingly. The clinical features might differ, but the clinical signs always remains the same. Okay, that's the main core which I wanted to emphasize. Okay, then again, this is the WHO grading saying no pneumonia, severe pneumonia, very severe pneumonia, and these are the classification features on how do you go about it. Then again, how do you manage it? Again, investigation, again it's the same thing. So extra thing which is there, I'm just writing. So again, to look for complication, what is the major complication? Again, sepsis or pleural effusion is something which you need to be aware of. So for that you need to do this. Again, this is the same thing which is there in medicine. You can refer medicine and you can come about it. Also, one thing while writing management ka aims, one thing which people forget is about the nutrition and growth chart. So whenever you are writing for any sake of for any disease, you can always write one aim of the thing as to monitor growth and to look for nutritional status or to address. Okay. So any 10 mark or 5 mark for any disease of for that matter, you can write this as one of the aims. And remaining aims obviously to reduce infection, to prevent complication, to talk about electrolyte imbalance, or it might be something related to metabolic acidosis component. Everything related same as in medicine you can place. I hope you are feeling convenient based on how I am discussing, so that you are not in a other place. So this is like how I study. Okay, I combine so that there is nothing extra which I feel that there is. If there's something extra, then your mind feels like, oh, there's something extra. But whenever you feel that it's the same thing which I studied in medicine, these are the extra things which you need to add, then it will be relief to your brain also. That's what I follow. Then what are the other diseases which are not there in medicine but is a core part of pediatrics? Is acute bronchitis. What happens is that lower inflammation and narrowing of bronchial tree secondary to acute lower RTI. Again, this is most important causes about viral which you need to talk about. And again, that's the same thing. Again, these are the signs almost remains the same, but here obviously while writing clinical features you need to mention about that also. Again, management, one thing which you need to talk about is this. Okay, but again, if there are any congenital heart diseases which are associated with bronchitis, then you also have to start with ribavirin. So that's all. Okay, then asthma, again refer Davidson, because I have already given you the flow chart where we have mentioned about this. Then also we will check for FEV, mention same thing, but what is the extra thing? If you can remember these things. Again, dosage is changed. Dosage in this is again based on your weight of the child ka formula. For example, there here ipratropium bromide ka dose is somewhere about 0.5 mg per kg. Then MgSO4, where they give 2 mg per 2 gram IV over 2 minutes, here you give it as 25 to 50 mg per kg IV. Okay, then also salbutamol is I think 0.15 milligram per kg or something like that. So again dosage changes, but again the flowchart which you read, you can write the same thing. Okay, that's what I wanted to say. Again, what is asthma? What is the major thing is that they have asked about status asthmaticus itself. Okay, how do you manage it? So make sure you study the same thing, and these are the extra things which you need to remember. That's it. And also empyema thoracis, that means there's pus in the thorax. So what do? Obviously you have to drain it because it's a pus. Then again you have to give antibiotics to remove that. Then also if it's not removing, how do, you have to just do a fibrin, do an occlusion and you remove that. That's what, these are the 3 stages. Okay. Then again, the upper respiratory tract infection, for example, croup, epiglottitis, or something which is core pediatrics part, which is not seen in medicine usually, or ENT for that matter. So again, I know you would have studied under ENT itself. So these are the some general things which you need to mention. I'm just underlying some important things which you need to present, so that by seeing this, they give you marks. Okay. Again, croup. Again, I hope you also know the mnemonic for this. P for para-influenza, U for steeple sign. Okay. So just to make sure you remember all these things, then R for again you give racemic mixture of Dexa, all those things. So again, it's based on your convenience, however you feel like remembering, remember it, because these are some core core part of pediatrics, except things which are not there in medicine. Okay, that's all with RS. Coming to CVS, I know CVS, there also you have congestive cardiac failure, you also congestive cardiac failure, but here the major things are different. Here the etiology itself is might be due to majorly congenital heart disease, right? So I have included that part. Okay, whichever is included, I have included, but major things which are not included, I request you to go back and see in medicine. Okay, so again, this is the question. Again, the major thing is what? Major thing is congenital. Then again, you can also talk about acquired. This divide it and then present it. Okay. And again, clinical feature, as I told, this is the main thing which they see, man. Even if you have not written the system specific signs, they are very keen to know about general signs. Okay, so that you know how do you check for that. And again, these are the signs which you need to mention. Okay, again, investigation, as I told, again here to diagnose and to find the etiology also. Then again, one important thing is you have to remove the contributing factor also. And also these are the general measures and these are the specific measures. Okay, rheumatic carditis and infective endocarditis, especially rheumatic heart disease, is the core pediatrics part. And if you can, there's one favorite line which they rheumatic heart disease licks the joints and bites the heart. So what is the main core of the disease is to prevent secondary attack. This is the core. That's why they are very keen on asking about the management, about benzathine penicillin 1.2 million units for how long. That's the core of rheumatic heart disease. Okay, if you cannot remember anything, at least remember that quote. Okay, at least by that you will be able to come to a conclusion on what is important. Okay, so it's also a socially evil disease. That means it's seen in poor people. Okay, that's what is described in standard textbooks. Okay, again, this is the major thing. Again, I'm sure you know about John's criteria, major, minor. I know I have not discussed in medicine, so I would given the old notes here itself. Okay, you can just refer the same things. Again, this is something to do with Jones, the same mnemonic which you can use. Again, the major things which all I have mentioned here, please refer the same thing. Again, minor criteria, again divided into clinical and laboratory criteria, and then place it. Okay, these are the differential and these are the principles. Again, if there is complication, you need to treat that also. Again, primary prevention is before the disease has happened, so you have to give dose of penicillin. Again, secondary prophylaxis, this is something which is core and you should know in and out. Though you might not see cases of rheumatic heart disease now, but it's your duty to remember it. Even if they say, even if you do DM cardiology, this is one of the questions which they ask in their paper. So that's what the importance of rheumatic heart disease is in this stage and this era. So make sure you study it in detail. Okay, I don't know how much emphasis has to be given to this topic, so please study it. Okay, so these are the divide it and place it, so that here what is the main aim? To prevent secondary attack. If you are having a secondary attack, then the valve situation will be even worst. Okay, to prevent that we are giving this, so make sure you know it. Again, if you are having allergy to penicillin, again you can give erythromycin also. Okay, then again, congenital heart disease, this is the core pediatrics part, you should know in and out. Again, for cyanotic, these are the two things which you need to remember: structural and obstruction, obvious characterization of aorta, and fight is TOF, TAPUCT, the TNTG. I am sure you can study about this, but the The major thing which is the important thing is about the TOF, which they ask again for components of TOF and how do you manage, and breath holding spells. This is the major thing, and I have discussed all the pathological progression with the components here. So make sure you write the sequence the components also accordingly, because of that the next process will happen. That's the importance of knowing the sequence also. So make sure you know that properly. Again, these are the hemodynamics. Than writing hemodynamics, divide it as RA, RV, LA, LV, then lungs. So now you place the disk. For example, whatever has happened, you show that in the hemodynamics part than writing in the words. That makes things much beautiful. Okay. Then again, cyanotic spell. Again, major thing is again how do you manage it. So for that, pathophysiology is something which you need to know. Okay, what is the major thing is to decrease right to left shunt, which is taking place. Okay, so if this is right and this is left, so this is the major thing which you need to decrease so that the cyanosis part is reduced. One thing is that you have to either reduce venous major thing is again you have to talk about everything which is present as a aims under this. Again, you can reduce systemic vascular resistance, systemic venous return, so that there is no preload, or that is reduce the venous return, same as SVR. And again, you have to increase systemic vascular resistance, so there is less shunting. And also you can do surgical correction at 1 year, that is BT shunt. And also you can give oral propranolol so that it reduces, and also you can give iron chelation. So this is what you do in a acute setting, that is in an emergency condition. Or what do you do? Again, you make in the need just position to increase vascular, that is SVR, systemic vascular resistance, and obviously it's a cyanosis part, you need to treat that part. So obviously give oxygen, and again to suppress the respiratory center you also give morphine. Then to increase systemic vascular resistance and to go and to make the baby go into sedation, you give ketamine. Then obviously to reduce artery, you give propranolol, and also you can give phenylephrine also. So whenever you are writing that, make sure you write the cause also, because this is core. This even nurse can write, but why you are giving this is something which is important. Okay, so and also to correct acidosis you can give sodium bicarbonate also. Again, this is what I told. While writing, make sure you write this so that you will only understand. Well, if you draw this diagram and start explaining things, then you are in a better position to answer all the related things also. So, and again, I will draw the clinical features based on what is the type of defined, whether it's small, progressive, or where is it. Based on that, I have done. Again, there is nothing much for me to explain. Again, based on when you go for a surgical repair is something which they expect you to know, and what is the contraindication. Again, PDA. Draw this diagram. This itself is self-explanatory, and again this is one of the important thing which you need to manage, which you need to know as an intern also, because if you can do this, you can cause the closure of that is you can prevent PDA also. So if it's not getting, then you have to go and like it. Okay, this is main, because as soon as that you cannot do till 6 months you can beat if it's a small PDA. Okay, that's it. And also important thing is criteria. This is core pediatric cardiology. So please go and check what is the history of it. The history itself is so beautiful. So what was the major history is that many people were unable to come to a proper conclusion whether the baby has a congenital heart disease. So this gentleman, what he did was he made some major criteria. He made some minor criteria also. So based on what he feels, for example, there are 3 major criteria. Okay, it might one is systolic murmur more than grade 3, or any diastolic murmur, and CHF, something like that. And again here, what is the main thing? Systolic murmur less than grade 3. Okay, the main core idea of NADA's criteria was whether you need to screen this baby for congenital heart disease, because there was no echo at that time. Okay, or even now if you want to send a baby to echo, again you need to calculate the score, and then you have to check whether you have to send a baby to echo or not. Though now right and left you can do echo, but this is what the main core part of NADA's criteria is. NADA is not an Indian, is from German, or I think is from Russia somewhere, I'm not sure. But make sure you go to ChatGPT and check what is the history, because the history itself is beautiful, man. Once you just study the history, I'm sure you can remember every part of it. And also I think here or somewhere you get cyanosis. So basically if you want to, if these two are there, then there are high chances. These two are what? These two are complication because of congenital heart disease. The major core itself is what? Cyanotic and acyanotic. Then if you are having cyanosis, then obviously it should be a major or minor criteria. Then it's congestive heart failure is a complication of heart disease. So that itself can also be a major criteria also. So that's how beautiful it is. So make sure you study that. Not studying, enjoy that. Okay, that history itself is beautiful. That's one important thing. Then I think major part of CVS also I have covered. I think that should be enough. Okay. So that's with 15 marks. Now coming to CNS, 10 marks. So again 10 marks. Many things are overlapped under medicine. So my thing is again in pyogenic meningitis. Again the major thing is what they ask you is about the etiology is something which is changed. Then this etiology with the RS, that is pneumoniac etiology, is one or plus or minus the same. So study that part. You can write the same thing here also. The major idea is again what is this? Gram negative. So now you know the concept. You need to fit it in the place and come back. That's it. Okay. Again, this I have taught you, so I am not discussing. So again here, what is the major important thing under CNS pyogenic meningitis is, again if it's a gram positive, again what do you give? Penicillin or penicillin. If allergic, then you can give erythromycin, all this blah 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 blah. But if it's a again you can also give safely, you can give ceftriaxone, except one again that's a neat PG question, that except Listeria meningitis you can give ceftriaxone each and every case is okay, not for viral or parasitic, but talking about bacteria. So again you can write about that and give, if it's a resistant, if it's MRSA you give vancomycin. Again if it's not working you give Lina, all those things. Again it's a core microbiology part, I don't want to discuss that, but know those concepts. Again there's nothing for me to explain here. The major things which has been changed I am just explaining, so that you place this under medicine only and add these things as extra, and you come back. Okay. For TB and complications also, please refer medicine. One important thing is about the SNHL part, which you have to mention also. And also while writing complication, also mention about the specific organism things. Okay. And under meningococcus mention about adrenal hemorrhage, which can lead to shock. Okay, I think you also know there is a name for that, Waterhouse prediction reaction, something like that. I'm not sure, but mention that because that's something which shows that. And also while writing clinical feature itself, also if you write meningococcus, you can also write about the rash and all those things. And also here you can also talk about prevention, vaccination part, and also you can talk about the how do you treat contacts with rifampicin. Every part you can discuss. It depends. Basically, if it's for a 10 marker, you can expand your knowledge, or you can expand the things which you can write. But if it's a less, you have to limit yourself. Again for TB meningitis, again refer the medicine part. There's nothing much for me to explain. It's the same thing, but now this HRZD being replaced by HPZM plus HPN. Okay, is something which you need to as a new guidelines, latest guidelines. But write HRZD plus HRE also again, and then again in the next line write as according to latest guidelines. This is what we are following, HPZM plus HPM, that is moxiflox, and rifabutin is something which is added new. Okay, so they know that you know even the previous regimen and your regimen also. It's like you are being updated than the books also. Correct? No, that's what they want you to be there. Want you to do. Okay, one more thing important under CNS part of pediatrics is about cerebral palsy. Core pediatrics, again it's one of the sure, many of you might get the same case for your final exam also. I'm sure you would have studied it, but again I have placed it accordingly. Again etiology, divide it accordingly and place it. And also about the clinical features also you can mention, so that again general and CNS specific also you can write extra CNS, and again if you want to still cut it down, again you can write into sensory, motor and reflex. But this is what CP is a core motor disease, so you need to explain or elaborate more on motor things. It's like how the basic thing is how do you fit a clinical features in one part of the page which is provided by the university, right? So this clinical feature itself as a core you can present it. Then again Based on motor deficit, again you can have pyramidal, extrapyramidal, or cerebellar, or mixed, that is, or atonic also. So based on that, again you might have quadriplegia, or diplegia, or monoplegia, or triplegia. This is quadriplegia, then diplegia, monoplegia, all those things. I think you know it. I don't think I need to come in talk about that. Again, it's a diagnosis. Again, major thing is to localize. And again, if there are any other complication, that is any other syndromes or any other problems, for example, if there is any hearing problem or if there is any vision problem, you need to discuss or you need to address about that also. That's something which is important, which you need to talk about that also. So that all things I have mentioned, but the major core is to do an early diagnosis. Okay, that's one thing which is important. And also these are the comorbidities which can be present, so make sure you, because this is last, so I just presented it accordingly. Then one thing which they need, which they see, which they search in and out of paper of cerebral palsy is about multidisciplinary treatment, where you need to talk about all these things. Okay, in and out of all these things is something which is important. Febrile seizures, again, it's a core pediatrics part. Again, these are the classified or the types which are there. It can be typical, atypical, or if it's more than 30 minutes, it's got febrile status. Then again, with many other conditions. Again, I don't think the major clinical feature is to rule out intracranial tension. That's the major thing. Again, the major thing is you have to talk about the counseling part. I don't know whether how to counsel the family about, it's a normal thing. Again, you have to also talk about the recurrence. Again, I don't know whether it's important, but I mentioned because I felt it was important. So these are the risk factor. These are the criteria based on which you can say whether it's whether the baby has a chance to get seizures in the next thing. Okay. Again, status epilepticus. Again, the core medicine part only. It's always based on whether you get an IV line or what. Or if you have watched any management of epilepsy in your emergency, then you won't forget it for your lifetime. First they come, and what you do is first obviously go with ABC. That means you put the patient on left lateral position and check GRPS, then you rule out hypoglycemia. Then next thing which you do is you try to get an access of IV line. But if you don't get an access of IV line, what do? You give IV intranasal mida, that is midazolam, that is 0.1 mg per kg body weight. Then again, if you are not able to get an IV line, even after that, again you try giving midazolam once again. Again, if it's not happening, then you go for a second line IV drugs, second line drugs, for example, phenytoin or levetiracetam. That again, if you are not getting IV, so you have to give what is the next route, which is there, AM. Okay. Then again, if you are not able to do anything, then obviously you start with any anesthetic drug. Okay, that's the core general idea which you need to have. Based on that, let us place it accordingly so that you can manage, you can present the things properly also. Again, this is the definition, these are the types. Again, these are the etiology, then these are the investigations. Major thing is people forget about this, but make sure you don't forget. Okay. And again, first 5 minutes, what do? Airway, breathing, circulation. Okay, next 5 minutes, next 10 minutes, what do? Again, based on IV line, start first line drugs. Next 15 minutes, what do? You start with second line drugs. Then what do? Consider refractory and refer to anesthesia for further management. Okay, that's how you have to go. And again, core part of pediatrics itself is hydrocephalus. Again, there can be two types, that is obstructive or non-obstructive part. That is also can be communicating or non-communicating. These are the causes. And how do you manage? Again, it's a major core surgical part of it. Again, VP shunt, and they will ask, if it's a Viva, then they can ask continuous question, which side, right side or left side, why left side. Okay, there are a lot of questions. Okay, pediatrics, though it might be for 100 marks, the questions which can be asked is huge. Okay, there is a lot of things which you need to study, but problem is for theory exam, there are only few things which are important and you need to study only that. Okay. Again, these major thing is for do a diagnosis. Again, I have to talk about head circumference. I think I have talked, I don't know. Okay. This is something which is important, and all three signs which are important, you have to mention. Okay, this itself can fetch you about 1 mark. Okay, make sure you write all these things also. Again, this too is important. Then again, acute flaccid paralysis, it's a proper common part, but since it's under CNS also, I've just mentioned it. So these are the causes. Again, this itself is a 3 mark there, as though I've just written it. So again, main idea is to check whether it's due to polio or not polio. So that's the, so based on stool sample, whether if it's an adequate or an inadequate, based on that you do the things accordingly. Again, you go for follow up if it's an inadequate. Then if it's not there, then you discard it as not polyester. Okay, next important thing is hematology. Again, it consists of both proper hematology and malignancy also as proper. Okay, again, thalassemia, sickle cell anemia, erythroid spherocytosis are core ITP and the VWD. I guess these are the core, not core also, but these are the questions which are asked in pediatrics. So I've mentioned it accordingly. Again, these are the things which you need to mention. Also, anemia after 6 months. That's one thing which they search in your paper still. After 6 months. Then all this hemolytic phases itself there as ones for 3 marker, correct? So you can mention about that also accordingly. Okay, these general things is something which they check for. Again, don't think I also, now they have started doing prevention also. They do something in pregnancy only, they try to check whether the PP has thalassemia and all, and offer you MTP also. That's also something which you need to remember also. Okay, then management, again nutrition and growth, everywhere you have to mention about that again. Okay, these main important things which people will forget. Again, causes of aplastic anemia, again I think you would have studied in medicine itself. All this important condition you can remember. Then again, acquired is something which is more common than inherited. You can write about that also. And sickle cell anemia is something core pediatrics itself. So again, clinical features, again can talk about this. And how do you go about managing of the, and also all these things. Again, how do you go about managing the things is something which they check whether you have written all these 3 things. Again, antenatally also you can diagnose these things, and also about hydration and analgesic. Especially hydration and analgesic is the core to prevent that part of the investigations. The same blood parameters which you know. And ITP I'll be discussing under part 2 of medicine. Okay, I'll be doing that video also. I'll be discussing it there. I know it because I had written in under medicine. Before after uploading the video, I'm sure I will come and discuss that part. Please don't worry. But it's your duty to finish ITP and WD also. Okay, I've skipped it here, but I will include in the next part of medicine. Okay, then under malignancy there are only 3 things which they have, that is ALL and clinical feature of Wilms and one more. I'll come to that part. Okay, then again classification, I'm sure you will write about all these things. And also my advice would be watch Maru's rapid revision, word of revision video under Pharmac. I think it's a last video if I'm not wrong, last but one. He has explained the pharmacology part of malignancy very beautifully, both for solid and liquid tumors. Please refer that part. Okay, again here the same thing here again about leukemia. I don't want to talk much. Again, while writing clinical feature, again you can due to infiltrative CNS and due to compressive symptoms, all you can write. Again, these are the major things which you need to talk about. But one thing again, you have to do all these things. Please talk about while mentioning about the schedule, you can talk about VPI, that is vincristine, prednisolone, and aspergine and doxorubicin, not doxorubicin. Okay, these are the 3 phase where you give. Okay, so and also cranial prophylaxis, because why do we do LP if it's already CNS? If CNS is already involved, the stage will change. Okay, so that's the core which you need to know, which you need to understand. Then again, I think the notes itself will be self-explanatory. If you go through it, it should be more than enough. Then neuroblastoma, again, is something which is important and people forget. So this is something which you need to remember as an extra point. Again, for WIMS, again, one important extra thing is it also can present you as hypertension with the basic triad is abdominal mass plus fever plus hematuria plus or minus hypertension, and these are the general things. The only clinical feature is something which there is, so make sure you study only that. Okay, now coming to the nephrology part. Major part of nephrology we have already discussed in part 2 of medicine only, that is paper 2 of medicine audit. So I don't want to waste much of your time. The major thing is the protocol which has changed from MCD. So this is what was given, so I've just mentioned. So what is the maximum dose of prednisolone which you can give is 2 mg per kg body weight. Okay, so you start with that. After you diagnose it's any nephrotic syndrome is incident is MCT unless proven otherwise, provided it fits into that category of in under urine and blood. So based on that, again you see for response. Okay, if it's basically any nephrotic syndrome which doesn't relapse is something which is shocking. It's very surprising. So based on relapse, again you can further classify it as whether it's a frequent relapse or whether it's a infrequent relapse, or it's a resistance case. If it's a resistant, please refer to specialist. But if it's an infrequent relapse, and again you can start on prednisone, then again you can start with 1.5 mg per kg body weight in alternative days for 4 weeks. Again, if it's an frequent relapse, again you have to check for steroid threshold. So again you can consider adding steroid sparing agents also. Again, UTI, the major thing is this thing which is not discussed under medicine. So this thing is something which you will have. Then again, management protocols remains the same. But one thing which you need to talk about in especially VUR, under VUR. Okay, I have not discussed VUR here because that's it has been repeated. But make sure you study that. Okay, you also have to look for scarring. Okay, where you also will talk about DMSA scan. Okay, that's one thing which I mentioned. Please make sure that you talk it accordingly. Now again, nocturnal analysis. Again, there's something called as 2 + 3 = 5 rule. That is, even if after 5 years there is no bladder control, and again if it's for 3 months, at least for 3 months of dryness, that is for secondary. Okay. Again, this is something which is core. You have to rule out always secondary. And major thing is many people will be benefited with behavioral, and there is Alram and desmopressin itself. So these are the options which you have. Okay, so that's it. It can be just a 3-marker question. Okay, so study only things which is important. Okay, next gastro part of it. Again, it's a 5-marker part, but sometimes they are asked even for 10-marker. The major thing is about the acute diarrhea program. I know from second year you are studying it, so I am not mentioning much of it. Again, these are the causes of acute diarrhea. These are the clinical features. Okay, please make sure you write if they are not asked about specifically about complication, draw a flowchart again related to complication, explain so that you are in a safe position. Then again, these are the treatment goals which you need to follow to identify, to look for dehydration, and also whether the baby is is having feeds. Okay, these are the principles of management. I have not written wantedly because I wanted to go and fill it. Okay, because I'm done. Okay, so then these are the composition of low or smaller ORS. These are the causes or etiology of persistent diarrhea, which I'm sure you can just go ahead. Again, here portal hypertension, why I wrote, even though I taught you under medicine, is that here congenital things you need to talk about. For example, agenesis, atresia, fistula, and all these things. Okay, this is the major core thing which you need to talk. PCSS, Budd-Chiari syndrome, or veno-occlusive diseases also. Complications or diarrhea, the same thing which I studied in medicine. Okay. Coming to endocrinology part. Okay, the major thing is here the decay part, the same thing which I have explained in medicine paper 1. Yeah, the same thing you can write, but skip yourself than while writing dose is what I will say. The major thing is again IV fluids, then again K+, then again insulin. So you can refer that part. Okay, and the major thing in under this thing is about the congenital hypothyroidism part, which they will ask. So again, these are the etiology and these are the clinical feature. Clinical feature, major thing is they will see about this. Then also signs which you need to mention. I think I would umbilical hernia also. Then these are the other causes. Again, how do you manage it is something which they are very, very, very keen on. That is, you have to start them on oral lever once you have even a suspicion, because otherwise, to prevent what? To prevent cretinism. That's the major thing. Then that's why they want you to know. Under miscellaneous, this is one thing which is very, very, very important. Okay, they might ask or they might not ask. Okay, it's a close differential for ARF also, so there are high chances they might ask. These are the clinical features. Again, here the investigation aim is to rule out secondary causes or secondary other causes, for example rheumatoid or something like this, or septic arthritis, most common than rheumatoid in children. Correct. So again, if there are any organ specific involvement also. So these are the medical therapy which you can follow, and these are the complications. Okay. Now coming to the proper community medicine part, I have not written it in a proper way. I would request you to go back and study the notes which are made. For example, even IMR I have skipped, and also KMs, that is kangaroo mother care, also I have skipped. Not wantedly, but I want you to discuss that. I wanted you to go to that part and discuss that part also in very broader way. Okay. Just the objective, and these are the key features. IMR is something which I request you to go and see. KMs is something which I request you to go and see. Also have a brief idea on ARI, and also have a brief idea on AFT. That those things I have explained also about acute diarrhea. These are core community part, but our major aim as a developing country is to reduce IMR. This is the major aim. What are the 5 causes of IMR? That is respiratory, GI, and other accidents, all those. But these two are the core. That's why we have vaccination. If you see, the major thing is about how to prevent pneumonia, how to prevent diarrhea. Okay, so that's the major thing. I've given you the idea. Please go back and see. Okay, till now we have discussed about systemic pediatrics. So the overall aim was of us to combine systemic pediatrics with medicine. And one more topic about toxicology, which I'll be discussing later. Okay, because again, snake bite is something which they will ask, and the dosage is same. Okay. It's not based on meat. That's one thing which is important. So you can just study that part. There's nothing extra. So I kept it at last. So now coming to proper core pediatrics. See, core pediatrics, the nature itself is like you need to know a lot. So I cannot give you a proper note. So what I have done is I've just given you an idea. For few things I've written. For few things I've just copied the images itself. So you can just go through that part. Then again place these things accordingly, and you can come back. Okay, the first section which I discussed is growth, development, adolescent, nutrition, and micronutrients. Then these are the core, these are the single classifications which are there. Again, which is the two most important thing which can be expected for a 10 marker is these two things. Again, micronutrient in health, and this is, you have to refer ophthalm and ortho. Why ophthalm, vitamin A, why ortho, rickets. I've been not talking about that in this part. Okay. So something again here ADHD and PICA will be talking. Adolescent health, again SMR is one RS question. Development, again this is our overlapping topic. See, this is one, either this or this should come. Okay. So these are the two main things which you need to develop. This is for 3 mark core. 3 mark core. Okay, so we will be landing with 15 marks. Okay, let us see. Okay, obviously after RS4, the major thing for 10 marker is one question has to be, the 40% of the paper should be a CBQ. Okay, that's what their guidelines say. So again, they might ask you about a short stage like CBQ, and they might ask how do you define it and all those things. Again, what is short stage? Again, there are 3 definitions. You have to mention all those definitions. Okay, all 3 these things you have to write. Again, while writing etiology, divide into physiological and pathological, and write everything. For example, see, again I have classified as under system, all those things. Okay, the major thing is they have to differentiate whether it is due to GH or hypo. That's the major thing. And mostly many in OPD what you say is something related to physiological, where you calculate mid-parental height and come to a conclusion that it might be a physiological thing. Correct, but this is what they don't want you to miss. But these are the other causes which also can be there. Okay, and how do you assess? Okay, obviously you know about infantometer and stadiometer. You can assess that. Then again, one definition itself is based on your velocity, height of velocity less than 25% per age. So you will measure that. And again you use a growth chart. Then again you calculate a mid-parental height. Then again you measure US-LS ratio, because based on that you have proportionate and disproportionate, and half of your things will go under your differential. So it's important for you to mention about that also, and you can also mention about your SMR staging also. Okay, then these are the management goals. So basically what is the important thing, you see what I told is about the physiological dwarfism, which is the major in management what it goes about psychological counseling. Okay, if it's a physiological thing. Okay, then if it's a pathological, then you also have to highlight the positive aspects in child's development. This is what is given in OP guy. Okay, so I have mentioned, it is not my words or my some materials. This is what was given in OP guy, so I just mentioned it. Okay, and also rehab. If there are any chronic condition which you need to address, you can mention about that. And these are the specific therapies. For example, if it's an infection, for example, if it's hypothyroid, start on levo. That was one of your endocrine question, right? So you can mention about that also. Then major thing is regular follow-up. Okay, and these are the causes of proportionate and disproportionate. Basically, if it's involving your bones and spine, it falls under disproportionate. Something related to systemic is always proportionate. Okay, you can mention about that. These are the investigations which you need to mention. Okay. Again, how do you now go about it based on your physical examination findings is what they are expected to know. Then one more question which is there is failure to thrive. That is the baby is unable to gain weight or even without any obvious cause. Again, how do you come to a proper diagnosis is based on your clinical diagnosis, based on your charts, and these are the causes. Okay. Again, clinical features for that. And again, treatment goals almost remains the same for both of it. Okay, except this is the major aim which you need to follow here. And again, causes of delayed dentition is something which they are asked, like in physiological and pathological. These are the major things which you need to mention. Okay. Again, growth chart itself is a 5-marker question, but I was little confused to what to write for a 5-marker. So I just just given what are the things which is there in the book itself, so that you can present it accordingly based on what you feel is important. For me, what I feel is important is the definition and the chart, and how to go about it. Okay. Short stature, I think I've discussed. Growth velocity is one question, so I just mentioned that. Okay. Development, again, you should know about all the 4 domains of development, that is language, motor, and gross motor and fine motor things. Then based on things, you have to study about what are the red flag signs in the child development, what are the causes of delayed development. Okay, define growth and all these things. Again, you can start from important things. Okay. Then related to ADHD and pica, these are Brett-Holding spells we have already dealt in CBS itself. Okay, I'm not discussing much on that. Let me again, pica, they have discussed about how to go about it, what are the types and what is the etiology and how do you treat the condition. The major thing is about your associations which you need to know. Okay, based on that you can rule out those associations if it's there or not. Again, you can manage it accordingly. And also about temper tantrums, again, this is one of the thing which can predict whether the patient whether the child is having any other psychological conditions also. So make sure you study this part also accordingly. The major thing is about the management which you need to write in and out. Brett-Holding spells we have discussed, so I'm not discussing much. Again, it is important. Again, you have to mention about the DSM-5 criteria. If you can remember, then that is good. Again, at least don't study about the pathology part and all those things. Again, you study about the definition, the risk factors 1 or 2 you can remember, clinical manifestation. Again, it's 3 important things. Again, attention deficiency, then hyperactivity and hyperimpulsivity is something which is core. Then based on that you can also make a proper diagnosis. And a major thing is about the behavioral therapy and medication. Though they won't recommend in below 6 years, you can write about these 2 drugs. Micronutrients, please refer ortho and ophtha. Okay, I'm not discussing much because I think I have discussed it on many subjects. Okay, then again, electrolytes, acid-base balance. Again, I'm not discussing much. There are the broader concept where they can ask. Again, this is the concept of if it's a sodium, why need to know its relation with water and all those things. I'm not discussing much. But one thing which I feel is, electrolytes or metabolic component comes as a 3-marker. One thing which you need to know is, even if it's a 3-marker, you cannot write just 3 things and come back. Write all the things and also mention about the ECG. Write an ECG and mention about changes. Again, what is the P change, what is the QRS complex cut change, what is the T wave change. All this if you write only, then you can get 3 marks full of full. Based on your invigilation, or based on the evaluator, obviously I agree, but why to be in the unsafe side when you know how to be in the safe side is what I will emphasize on. And again, treatment of hyperkalemia, I think I have already told it, so you can mention it. 2 treatment goals which you also need to mention. Just again, metabolic acidosis, write about AGMA and NAGMA and you can place it accordingly. And these are the causes of metabolic alkalosis also based on chloride responsive or chloride resistance. Then coming to infectious disease part. Again, I'll do a video about infections in under medicine, as I promised in the paper part 2 of medicine. So I accept that these are the extra things which I feel is important in pediatrics also. So measles is something which again general and specific. Mention this, and again these are the complications and how do you go with the lab diagnosis. Again, primary progressive complex. This is all they say. This is one of the questions which they ask in the alternate year. So make sure you study this properly. Again, how can it evolve? Okay, these are the components and how it can evolve is something which they want to know. That is nothing but primary progressive complex. Again, this is a part of PSM itself. That is codes and how do you manage and what are the equipments which are there. And again, as I told, one question either in 5 marker or 3 marker. One question is either infection or infestation, or one question is something related to BCG vaccine. Make sure you study NIS schedule also properly, because that itself can come as your major question. And also there are few vaccination part which you need to know. Again, here I cannot predict questions based on which can come, which cannot come in vaccine, because in and out of vaccine they will ask you in practicals. So you should know vaccination part really well. Okay, in and out you have to know. Okay. So this I've just written it. I am sure you can just go back and refer, so that you will only understand what I am trying to come to a conclusion. Again, neonatology part. One thing which I request you to go and study is about the lactational failure part. Okay, how do you manage it? Okay, I've skipped that, so I'm just saying you how to. I'm just requesting you to go back and study that part. Okay. Then septicemia newborn, again divided into early onset and late onset. Again, major thing is you should know it's a ill-defined disease, but either baby can present either baby can present you with features suggestive of pneumonia or meningitis. So based on that, again the major treatment goals is to one thing which people misses about the prevention part, which is the core. Okay, neonatal jaundice, I am sure you can understand. Again, they will ask you what are the 3 things for saying it's a pathological jaundice. These are the major 3 things which you need to mention. Again, these are the investigation goals. Again, they might ask you about indications of phototherapy, what are the side effects. There's nothing for me to explain, so I think it's itself is self-explanatory. And again, about when they ask you about birth injuries in specific, make sure you study, you classify accordingly. Saying cranial birth defects, then clavicle fractures, then Erb's palsy, Klumpke's palsy, shoulder dystocia. So you know that you are showing that you are thinking in a broader term than just writing about caput sexudenum and cephalometoma, which all of you write. Okay, so make sure you write all these things also. And again, RDS or ileal membrane disease, again this is something which is core neonatology. I am sure you would know it. Again, one thing which you need to write is about the prevention part. Okay, again NPR, that is the neonatal NRP, not NPR. So yes, neonatal resuscitation program. You should please study the new 2025 HA guidelines, which is being released, not the old one. Though there are not many much changes, but it's always good to be in the safer side. And also advantages of breast milk divided into mother and infant. I'll be coming to that part. I have photo for that. Again, SMR staging, once it was an RS question for males, so I just put up. So make sure you study that. Advantages of breast milk, again divided into mother and child, and while writing child, again divided into immunological factors and non-immunological factors, that is also nutritive factors, and then write. Okay, and then once also they had asked about composition, so I just mentioned that. Okay, this score 10 marker about the protein energy malnutrition part. So in and out of this is important. How do you diagnose? What is the etiology? And there are 3 ways to diagnose. So mention again this, if you can remember, if it's a 10 marker, right? If it's ideal if you remember, but I'm skipping this, but I request you to remember it. Okay, how do you classify? Then what are the theories, clinical signs, what are the spectrum? Again, I'm sure you would know the mnemonic of shield. And okay, so the same thing which you can mention it accordingly, and you can draw this table, you can place it and come back. Okay, I know I have not discussed that part in detail because it's 2 months and I didn't know what to write and what not to. And also one more important thing is about the snake bite. Okay, again these are the snakes which are broadly classified. So based on that, these are the first aid thing that is something which you need to know. Then again, the investigation part which you need to also talk about it. The basic thing is you have to mention about the bedside test which is mentioned, and also how do you go with looking for the systemic complications also. Okay, that's one thing which I would say. I think the notes itself will be self-explanatory. Make sure you study that part. Then also one more important thing which I feel I have missed is about the Down syndrome. Okay, core important part of pediatrics, but I missed it. I'm sorry. You can just go back and refer that part. Okay, let me be very clear. Without something related, a paper without something related to genetics in pediatrics is a not so good paper. So that is one thing which you need to or if they are not asking related to Downs, they might have something related to name three causes of AR, name three symptoms, name three diseases associated with AR or XLR, something related to that you will get. Okay, so make sure you study that part also in detail. Again, major thing is you have to know about the Downs. Okay, yeah, the overall idea, Down syndrome, and also those things, and also scorpion sting bite. Again, the drug of size is prazosin because it's an autonomic instability ka problem. So the major thing which I made video for this, because many were asking, one thing is that, and also I wanted to make sure that the approach part has to be correct. I don't want you to sit and study all the things which are studied in medicine again and again and again. It's almost a repetitive thing of the same medicine, except a few things which are core pediatrics part, which I am sure I have presented it accordingly, so that you know what are the things which you need to discuss, which you need to study extra for in specific system assets. So I hope I have done justice for the time which I have taken. Uh, uh, Again, study it accordingly. At least I'll not be sad if you don't study the same notes which I have provided. I'm least bothered. But thing is, I don't want you to waste time a day for exam and study from saying first chapter the history questions even if it's repeated one times. If you start studying, I don't know when you will finish. Okay, major aim is to make sure you study it in a proper orderly way, so that you don't skip the things which are most important, and you can skip things which are least important. So that was the major aim. So again, let me just come back and check whether I finished everything. Obviously, related to fluid electrolyte, one question related to 3 mark is short, which I have already discussed. Again, 5 mark by 3 mark, which I have already discussed. GI, again I have discussed. Okay, GI also we have discussed, and endocrine metabolic genetic thing. Again, please talk about Downs also. Okay, I think I missed about that part. Please refer to that part, and also emergency part. Okay, there are a few things which are not an RS question in this part, so I have skipped it. I hope it was useful for you. Thank you.